So, welcome back to GLOW 2020. My name's Andrew Weeks, for those of you who are just joining us, and I'm chair of the organising committee locally. Welcome to GLOW 2020 with a focus on implementation research and respectful care. For those of you who are trying to link in earlier, we had some technical difficulties connecting with our outside link to Annie Portela. So those of you who are linking in will have heard us. We extended the discussion with Sally Theobald and her team about how to do implementation research, and we hope you found that useful. For those of you who are coming in on the slightly different link to look for posters with discussion, we showed that a little bit earlier in place of Annie Portela's presentation. That link will be available once we've finished this, so as to enable you to click on it at a later stage. And in fact, all the presentations, as soon as they've been done, will then become available for you to look at a later stage. Now, of course, we couldn't really do a global maternal health conference without talking about COVID. It's affected us all. There's nobody who's been separated from it. It's affected all of our lives in one way or the other. And we're lucky that one of the benefits of doing an online program like this is that we can connect to distant places, usually, so long as the video link works. And respect to the BBC, they clearly, I now have greater appreciation of the sort of things that they go through. But it allows us to connect with really top people around, and we're very lucky to have two fantastic speakers who are joining us. So Ambrose Talisuna, Dr. Talisuna, is working in WHO Africa office in Brazzaville in the Congo. He did his medical training originally in Uganda, and then postgraduate training in epidemiology and public health in Antwerp, London, and the USA. In fact, he and I met when I was working in Uganda in 2001. I think when Ambrose was head of epidemiology at Ministry of Health, but from then on he's continued to rise through the ranks and has taken up senior positions in malaria control in Nairobi, Oxford, and now is in the WHO Africa office in Brazzaville. In fact, he's speaking to us from Pretoria, where he's working on the COVID response. The other person who we've got is Dr. Raji Tajudeen, known as Taj. Originally trained in pediatrics in public health, and in fact, when you read through his CV, it looks like a who's who of places to study. He's got qualifications from Nigeria, South Africa, UK, including here at the Liverpool School of Tropical Medicine, India, China, and the USA. And he's currently head of Public Health Institutes and Research at CDC Africa. And he's heading up the healthcare preparedness and countermeasures for their COVID response. So first of all, we'll go across to Ambrose Talisuna in Pretoria from WHO. Ambrose, are you there? I'm hoping that he'll be able to link to us and he can hear us. Ambrose, can you talk to us about the non-COVID effects of the pandemic?
Thank you very much, Andrew, for that introduction, and good morning, good afternoon, good evening, wherever you may be. These are very challenging times, and I would just like to talk to you this morning or this afternoon about the non-COVID effects of the pandemic. And if I can move these slides. I can't move the slides, Andrew. You might have to move for me the slides from there, Andrew, because I can't move them from here. Okay. In terms of as an introduction, really, in Africa, the COVID-19 outbreak is slower than what we had predicted, even if we think that we are underreporting, but also critical cases are fewer. But we are seeing that in some countries, they're really already, the systems are already overstretched, and because of demand, and there is also low inherent resilience, and I'll be coming back to that in a few minutes. When we draw lessons from the 2013-2016 West Africa Ebola epidemic, the death caused by disruption of essential maternal, newborn, and child health care services, and also programs like for measles control, for malaria, HIV/AIDS, and tuberculosis, far exceeded the direct effects from Ebola. And so the real things and COVID, the disruption is really very important, and we need to be tracking that. It has been projected that a 15% reduction in maternal, neonatal, and child health coverage during COVID for about 6 months could result into over 250,000 additional child deaths and maybe over 12,000 additional maternal deaths in low and low-income countries. And so this is really worrisome for us. And in terms of affecting continuity of health essential services, I think COVID is affecting across all the critical health performance pillars, as we know them, the four performance pillars of the health system. It's affecting access, and really people in terms of physical access, because there are barriers, there are movement restrictions, so physical access has been affected. But critically also financial access, because people have lost income just because in low socioeconomic status, I mean, informal sector, people have lost jobs. So COVID has disrupted that as well. Quality of health services in terms of has been affected. Demand, because people can't be able to visit the services because some of them are closed. And then a critical piece of it is also resilience. Let me just go back to a bit of talk about resilience. And this is really what does resilience entail? And in pre-outbreak, you need to have routine services. But when then there is a crisis, the services should be ramped up and should be able to deliver both routine services and also deal with the crisis. But when systems are not resilient, then you don't have that, what we call the resilient dividend. So continuity of essential services is disrupted. And we've been struggling this across the board. We try to build the international health regulations, health capacities, as we also build resilient health systems in terms of delivering universal health coverage. But at the moment, really, we are finding that on the continent, there are problems and challenges in terms of health systems, but also in terms of the IHR core capacities. We've been trying to monitor indicators, and several of the indicators that could track to help us to see whether a continuity of health services has been affected. And we've been looking at things like outpatient utilization per capita, inpatient utilization, bed occupancy rates, and also childhood immunization. And we have some data, a dashboard, and I will link you to that dashboard there. You could get the data that we have on that dashboard. But what we are saying is that OPD utilization and inpatient visits have dropped in 2020 compared to 2019 and 2018. Child immunizations have dropped, and in some scenarios, we are seeing outbreaks of measles because kids are not getting immunized. And the number of people accessing their TB drugs or their antiretroviral therapy has also dropped. So some countries like Namibia have looked at putting in mechanisms of door-to-door delivery of these services. But if you don't then do that, we will see that we might have excess mortality because the indirect causes of COVID are also very, very severe. And we've monitored some indicators working in what we call the Partnership for Evidence-Based Response to COVID, which is a partnership with Africa CDC, Resolve to Save Lives, Ipsos, London School of Hygiene and Tropical Medicine and Economic Forum, and WHO. We've been tracking some of these things, and we've carried out surveys periodically. And I'm going just to give you a snapshot of some of the data. The methodology we use is that we do surveys. Ipsos is mainly the one doing these surveys. So I'm just going to give you data from the August poll, which was conducted by Ipsos in 18 African Union countries. And samples were drawn from nationally representative member states, and we weight the data. So if you look at missed or delayed health services, 44% of the respondents say they had missed or in somebody in their household had the delayed healthcare service. And some of the reported disruptions were most common if there was a COVID-19 patient in that household, if respondents had a long-standing illness, or if respondents were living in urban areas. But surprisingly, with respondents with mental illness. So you can see people are missing their services, or they're having their services which are delayed. The reasons for the missed services are several, depending on the country, but if you look at the chart, couldn't afford it, largely because of cost. People have lost jobs. Facilities have been closed. In some scenarios, facilities have been closed. Facilities have been too busy. People are responding only to COVID, but also you can't get to the health facilities because of the lockdown or curfew. So you can see the reasons are varied, and these disruptions are really affecting the indirect causes of COVID. The types of meat services are also variable depending on the country. If you look at a country like Nigeria with the burden of malaria, 37% of the respondents had delays in visits for malaria. And so there are also combined disruptions in maternal and newborn and child care across several countries. So you can see in those charts, actually maternal and child health services are being disrupted. And so we need to be tracking maternal death, infant mortality, and under 5 childhood death. In terms of difficulty in accessing medication, you can also see, it's more than 1/4 of the respondents reported difficulty in accessing medication. Others reported missed or delayed services, highlighting which is high among the income respondent. In Sudan, for example, almost 2/3 of the respondents reported difficulty in accessing medication. And this is really, really worrying. In contrast, in Senegal, this accessing medication is slightly lower, but you can see it's also varied. And so we need to be tracking all this. And this is why we need to be triangulating data from different sources to look at how indirect causes of COVID are affecting the populations out there. And I think that's why we've been saying we need to have a balanced way of implementing these public health measures. I think this is my second last slide. If you look at the impact on economic and food security, a majority of the polls have said people have experienced barriers to purchasing food. So I think we can have lockdown, but lockdowns cannot continue for all the time. So you can see food insecurity is taking place. So if we don't relax measures, in some of these countries, people are not going to access even food. And then look at expectation. We also did on what expectation of people in terms of the trade-off between relaxing measures and the data are variable. So loosening restrictions, of course, people think that it is too risky to loosen restrictions versus there is a low risk and they need to get the economy moving. So the public health measures, I think they helped us in the beginning of the outbreak. But I think as we move now, and I think we are seeing some window of opportunity that in most countries there is a decline, we need to have a balance to be able to relax some of these measures. I can tell you some other concerns that our surveys have discovered. There is an increase in gender-based violence. There is an increase in some countries in alcohol use. The impact on children's education is very severe. In some countries, we are seeing teenage pregnancies just because young girls are out of school. So we really need to be tracking all these things. And you as researchers, we expect you to be helping us to do tracking these data so that we have a comprehensive COVID response. So to sum up really, in the absence of proven therapeutic remedies or a vaccine, all countries must successfully suppress transmission. I think we have to look at a scenario where we say we live with the virus, but in a suppressed transmission burden. And that will require robust testing, isolation of cases, and identification of a quarantine of contacts. But I think we have to look at practicing hand hygiene. And then we need to balance the public health, social, and physical measures because the indirect causes of COVID are huge. And we really need to be tracking direct COVID mortality, but also we need to track indirect mortality, all-cause mortality, to be able to see what is the excess mortality we are seeing over this period in 2020 for some countries, because we anticipate that we are having people who are dying from COVID, but we are having people who are dying from other causes because they're not accessing services, people who are dying from non-communicable diseases, mothers who are not accessing maternal health or antenatal services. Finally, I think the COVID pandemic has changed our lives and the lives of societies and individuals across the world. We need to adjust to a new normal. But for us to do that, we need to mitigate the non-direct COVID pandemic effects. I thank you for your attention.
Fantastic, Ambrose. Thank you so much. What a fascinating overview of it. And it's so true what we're seeing in many parts of the world, especially the low-income countries, where actually the non-COVID effects are proving far more dangerous than some of COVID itself. But let's go across to Raji Tajudeen, who's speaking from Addis Ababa. And I hope, hello, Now, what is it? Good afternoon, I think, for you, Raji and Addis, who's head of public health. Head of Public Health Institutes and Research at CDC Africa. Thank you for joining us. Can you give us your perspective on the non-COVID effects of the pandemic?
All right. Thank you so much, Andrew. So will I be sharing my slide from my side or you do it from your side?
We have the slides from here. So just tell us when you have when you want the next slide and we'll move on.
Okay, perfect. So I think we can start right away. So thank you, Andrew, and the entire organizing committee. Thank you, Liverpool School of Tropical Medicine, for this opportunity to be part of this important conference that is looking at the gender aspect of public health in general. So today I'll be sharing with you the non-COVID effect of the COVID-19 pandemic from Africa CDC perspective. So next. So the outline of my presentation will be one to give you a sessional update as far as COVID-19 is concerned. Then I will touch base with the non-COVID effect of COVID-19 pandemic in Africa. Then I will move straight to coordination and collaboration with member states and the WHO. And I will also discuss a little bit about health workforce, how Africa CDC has supported our member states. Then I will conclude. Next. So as of today, we are looking at more than 27 million cases of COVID-19 globally, with over 880,000 deaths. Coming down to Africa, as of today, we are looking at 1.3 million cases with over 31,000 deaths. It's important to know that the African cases are just around 8% of the global total. And in terms of deaths, we are hovering around 5% of the global total. The good news here is that over 80% of the cases in Africa are actually covered. Now, if we unpack the Africa figure further, you will observe from the next slide that close to two-thirds of the continent's member states are actually recording less than 10,000 cases. Next. So this slide is actually showing us where we have come from. Next slide. Very good. Thank you. So this slide is actually showing us where we have come from in terms of the number of cases on the continent. Sometimes in July, Africa was averaging around 100 to 120,000 cases per week. Today, we are around 50,000 cases per week. Next. So Africa has been described as a continent with syndemics, simply meaning that we have a lot of endemic, we have epidemic cases, multiple epidemic going on at the same time. A typical example is DR Congo, where currently we have ongoing COVID-19 pandemic there. We also have measles outbreak, we have Ebola, we have the vaccine-derived paralytic poliomyelitis, everything happening at the same time. So this underscores the need for us in Africa to come up with what is the best way in terms of public health measure to address most of these issues at the same time. So looking at the impact of COVID-19 pandemic on the essential health services, which is one of the key non-COVID effects of this COVID-19 pandemic, you will agree with me that most of our member states have actually suffered disruption as far as their routine health services are concerned. And the current estimates suggest that more than 90% of our member states have experienced some sort of disruption. And most of these disruptions actually affected the routine care, elective services, critical care. All of these have been interrupted one way or the other. In terms of specifics and in terms of number, the most frequently disrupted services include routine immunization, such as the routine measles immunization, routine polio immunization. Our services have been affected 70% of the time, and facility-based services actually been disrupted in 61% of cases. Looking at non-communicable diseases, this has been interrupted in about 69% of 69% of cases. Sexual and reproductive have been interrupted to the extent of around 68%. When you look at mental health, cancer diagnosis, malaria diagnosis and treatment, all these have been affected one way or the other. Next. All right. So one of the non-COVID effect of this pandemic is the effect on education. And you will agree with me that education is one of those key social determinants of health. And this pandemic has created the largest disruption of education systems in history. In fact, close to $1.6 billion have been affected one way or the other. In Africa, more than 90% of our students have been affected. The pandemic has also raised fundamental concerns about human rights. It has exacerbated pre-existing education inequality by reducing the opportunities for many of the most vulnerable children and youth. Vulnerability in terms of children from poor homes, children from IDP, children from refugee camp, disabled children, girls alike, all these have been affected by one way or the other as far as due to this COVID-19 pandemic. An estimate suggests that close to 23.8 million additional children may actually drop out of school. So I think this is the time for us to begin to see how can we mitigate some of these non-COVID effects. Other aspects of our social services that have been affected include things like nutrition. For some kids, the only opportunity for them to have nutritious food is when they go to school. So these services is no longer there. And for some parents, their place of work is actually the school environment. Again, most of these people have actually been put out of work. And of course, as Ambrose clearly mentioned, we are seeing increased risk of violence against women and girls. So the impact of this non-COVID effect, is likely to extend beyond this generation, and is also likely to erase decades of progress that has been made so far. Next. So part of this non-COVID effect, again, we have seen a lot of countries putting in place all sort of travel and border restrictions. We have seen closure of businesses, closure of schools, and so on and so forth. And for a continent whereby more than 70% of the populace rely solely on informal sector to earn their livelihood, you agree with me that this is something that cannot continue definitely. So this has led to a lot of socio-economic impact as far as the common man in Africa is concerned. And what have we done in terms of responding to some of non-COVID effects? We've put in place or put out there a number of guidance and documents to support our member states in how they should mitigate some of the negative consequences of most of these measures that have been put in place to contain the COVID-19 pandemic. So one of these is a continuation of essential health services guidance and document, which clearly spell out the need for member states to come up with a protocol that will govern delivery of essential health services, to put in place a monitoring mechanism, that will look at service delivery, look at service utilization, and look at the gaps and how best to address some of these gaps. And of course, we continue to emphasize the need for member states to make sure that for every opportunity to talk about COVID-19 pandemic, they should also talk about the fact that the essential services, the critical services, the routine services are still being offered by the different health institutions in the country. And we also advise member states to remove user fee so that this will not serve as a barrier for the populace to access some of these essential health services. And as we plan to recover from this COVID-19 pandemic, so there should be in place how do we make sure that some of the gaps that have been created, some of the negative consequences as far as this COVID-19 pandemic is concerned, is going to be addressed as we open up our economy. The other aspect of the non-COVID effect is the mental health and the psychosocial issue. So in this regard, Africa CDC rolled out a guidance document that look at how best to address the mental health and provide the needed psychosocial support to the affected and the infected. So let me shift gear and talk a little bit about coordination and the collaboration with member states. The first case of COVID-19 was reported on the continent on the 14th of February. A week after this, CDC, in collaboration with WHO, were able to convey a meeting of ministers of health from the 55 member states. And this meeting actually emphasized on the need for coordination, collaboration, communication, and cooperation. And one other aspect of our coordination is we've been able to raise this response to the highest political level, and this is the AU, the African Union Bureau of Head of States and Government, who periodically meet to champion what Africa CDC, together with other partners, are doing as far as COVID-19 pandemic on the continent is concerned. Another political layer is that of the what we call the coordinating ministers. So for the coordinating ministers, we are looking at the ministers of health, ministers of transport, and ministers of finance to make sure that our approach is what we call a multi-sectoral and whole of government approach to this COVID-19 response. And this ministerial or the coordinating ministerial committee regularly meet to provide direction and provide as far as our COVID-19 response is concerned on the continent. We have also put in place a steering committee, which is co-chaired by the regional director of WHO Afro and the director of Africa CDC, to also make sure that we develop what we call a continent-wide response strategy, to shape the way we respond to this pandemic on the continent. Under this steering committee, we have the different technical working groups that is like co-chaired by Africa CDC and representative from member states. So I think as far as coordination is concerned and collaboration, I think we have it well covered. Next. 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 Okay. All right. So when the ministers met a week after the first case was reported, one of the things that was endorsed at that meeting was the continental strategy. At the same time, a continental task force was also endorsed. And this strategy emphasized on three key pillars. One is that of prevention of transmission, prevention of death, and prevention of social harms. Next. So, we have also rolled out what we call partnership to accelerate COVID-19 testing on the continent. And again, this is aimed at bringing every member state together in such a way that in terms of key pillars of response to this COVID-19 is well coordinated and well, there is some element of collaboration as far as this is concerned. And in that aspect, we set out 4 key goals. One is to roll out testing, because you will all agree with me that one of the key areas where we had issues as far as the continent is concerned is issue of testing. In fact, people believe that it's because of non-availability of testing. That's why Africa is not seeing a lot of cases. So in early April, Africa CDC partnership with other key partners on the continent came up with this initiative. And the goals of this initiative is to roll out 10 million tests within 4 months. So I'm glad to inform you that we have long passed this 10 million target. And part of what this initiative actually set out to do is to support member states with 1 million community health workers. So that is still ongoing, to continue to build the capacity of our member state healthcare workforce so that they will be able to respond and effectively to COVID-19. And in order to make sure that all the medical supplies, are equitably available and affordable to member states, Africa CDs, as part of this initiative, also put in place a pooled procurement platform that will make sure that each and every member state have access to the necessary medical equipment and supplies that is needed for them to be able to respond to this COVID. So still talking of coordination and collaboration with our member state, we realized long before now that the most important game changer as far as this pandemic is concerned will be the availability of COVID-19 vaccine. So to be proactive, the leadership continent came up with a conference, that will raise awareness on the need for African member states to have equitable access and affordable access to this COVID-19 vaccine when it does become available. So that meeting was conveyed at the highest level. In that meeting, we have President Cyril Ramaphosa of South Africa. We have WHO Director General, the Regional Director, Africa CDC Commissioner, and so on and so forth. So these were all the key members that were in that meeting. Next. Right. So still part of coordination and collaboration. So Africa CDC put in place a COVID-19 vaccine development and access strategy. And the goal of this strategy is that of successful immunization of a critical mass of the African population with a safe and effective COVID-19 vaccine. Next. So for under this strategy, we have goals. One, to accelerate African involvement in clinical trial and vaccine development. Two is to make sure that there is access to sufficient vaccine supply. And three is to make sure that the issue of logistics and distribution are adequately covered on the continent. Next. Again, as part of coordination and collaboration, 2 weeks ago, Africa CDC and the African Union launched a campaign called Saving Lives, Economies, and Livelihoods. And the key objective of this campaign is, one, how do we safely reopen our borders and make travel as safe as possible? Two, how do we safely open our economy and businesses? And three, how do we safely reopen our schools? Next. In terms of clinical trial, we also have a technical working group that is looking at this to ensure that each and every member state, it's able to benefit from whatever vaccine, therapeutics, or diagnosis that is going on. And we're also using this opportunity to build local capacity to ensure that there's appropriate transfer of technology to support our member states. Next. So what have we done to support the health workforce in Africa? We realized right from outset of this COVID-19 pandemic that member states are not at the same level as far as health workforce is concerned. We know that in terms of health workforce, the gap is so critical that we just have to support some of these member states. So what we did was to mobilize workforce through the African Volunteer Health Corps platform to support some member states in need. So today we are happy to say that we have supported 21 member states with senior epidemiologists, and we have supported about 28 member states with community health workers. And we are not only throwing out those figures there, we are also supporting them with the necessary capacity in the different key response pillars as far as this COVID-19 pandemic is concerned. Next. So in terms of the key pillars, we are looking at surveillance, we are looking at clinical care, we are looking at infection prevention and control, we are looking at lab, risk communication and community engagement, and of course, last but not the least, we are also looking at supply chain management. Next. So I would like to conclude by saying that the COVID-19 pandemic has revealed a lot of cracks in our health systems. It also reminded us of the need for new strategies to improve healthcare provision during pandemics and beyond. And as a continent, we need to be better prepared for emergencies, but also keep investing in health systems and systems for health that can fully respond to people's needs throughout the life course. And we must see global health security and universal health coverage as two sides of the same coin. And for our member state, that coin is the National Public Health Institute. I thank you for your attention.
Brilliant. Thank you so much, Taj, for that overview from CDC. That's fascinating, and it brings up a whole hundreds of questions that we're all wanting to ask, and there's questions all coming up online. Unfortunately, one of the problems with global health online conferences is that people are signing into other sessions which are due to start in here in 5 minutes. And so actually, I'm afraid we don't have any time for questions. What we do have is an online platform whereby people can ask questions. And if Taj and Ambrose, if you could both have a look at the questions online and provide your answers for them. Because there are serious questions about data management and about how you collect accurate data, both on whole populations, so that we're not just concentrating on COVID, and so that we get accurate coronavirus infective data as well. But I'm afraid we need to call it a day there. Thank you so much to both of you for joining us from Addis and from Pretoria. I'm glad that the links all worked. The next session starts